for the opportunity to be with you today. I'm sorry I couldn't be there in person, but this is a very exciting event, and so I'm glad I was able to at least be here for a little while. I want to talk to you a little bit about pain and sleep in children, and it's very interesting that the research is now showing us that the two go very closely together. A lot of similar areas of the brain are activated when children have sleep problems as well as when they have pain problems. And a lot of the research obviously is being done with adults, but they're starting to move more into the pediatric populations now, which is very encouraging for us. So persons who have chronic pain, adults with chronic pains, between 50 to 80% of them also report problems with sleep. They have a hard time falling asleep. They have a hard time staying asleep. They wake up many, many, many times over the night. They don't have very good REM sleep. There's a lot of problems, so I won't go into all the details. And I'm going to go through this fairly quickly, so if anyone wants any more references for the science behind it all, we can certainly give you that later. I want people to take on board, too, that this is not a chicken or egg kind of question. It's not that the pain has interfered with the sleep or that the sleep has increased people's pain. The two actually work together in a cycle. So either or both of those situations at the same time can be going on for some individuals. So what happens when people have sleep deficiency? So when children have sleep deficiency, it actually affects their ability to perceive pain. So when they have sensory processing problems, that also interferes with their ability to perceive pain. So we know that with sleep problems, there's difficulty with healing and digestion and hormonal activity and the central nervous system. All these things that are going on in your body while you're trying to sleep are also sleep affects your psychological abilities, right? So children don't feel as well. They have more trouble concentrating. They're more moody. Their sensory perception, as we've already talked about, is affected. They're more anxious, and older children more depressed, potentially are looking for some kinds of substances to help them sleep better. These are all very common features as well in pain. So the two of them are quite clearly interrelated. And although that might seem overwhelming, it also gives us an opportunity to look at it from a different perspective, say, well, we have many opportunities to intervene in these two systems, so we can't become immobilized looking for the one right answer, because there is no one right answer. Maybe there's nothing we can do about a child's pain at the time, but we can certainly look at their sleep, or vice versa. Maybe there's something we can do for their sleep even when there's not much we can do about the pain. So just to show you a little bit more information about this, children with neurodevelopmental disorders and disabilities, so children with fetal alcohol syndrome disorder, 85% of them have sleep problems, and a number of them have pain problems, mostly musculoskeletal pains because of their altered sensory processing. Autistic spectrum disorder, those children, a high reported incidence of sleep problems, but also problems with pain, particularly gastrointestinal, seizures, and infections. Attention deficit hyperactivity disorder, those kids have sleep problems, and pain has been reported in studies. There haven't been a lot of studies here, but pain has been reported in quite a high incidence for the adults. Cerebral palsy, kids with cerebral palsy, again, more than half have sleep problems, and close to 70% in the study that's being done with pain perception in those children. And children with Down syndrome, again, we see these high numbers, so it goes on, right? The link is very clear. And there's a little picture in the corner of the slide here that shows the brain, and it's just to indicate that a lot of the same systems that happen in the brain around your hypothalamus, and there's no tests, so you don't have to remember all of this stuff, but those systems are involved both in sleep regulation and in pain perception. But assessment is really problematic in both of these when you're talking about children, and particularly children with sensory processing problems, right? It's very hard to understand exactly what's going on for those children. There are some very useful pain assessment tools that are being developed. This is a partial list of them. They're the kind of thing you'd want to talk to your pediatrician or your occupational therapist or another healthcare provider about what would be the best one to use with your child. So You can look at this slide later if there are ones that you want to download here. They're mostly, the commonality between them is they're based on observation. So you have to actually be observing the child at a variety of different times and then looking for facial features or certain body postures or sounds that they make, grimaces, those sorts of things. So those sorts of tools are available to us, but not all healthcare providers are as aware of them as we would like, and this is a growing area. These are emerging tools that we can use. I'd like to think of pain and sleep both as systems, and a system that has many interacting components to it. There's all the biological things that are happening in the body. There's our beliefs and our values about pain and about sleep, about how children should react to pain or when they should go to bed, those sorts of things. There's the social forces. We live in societies that are very, well, they keep us awake all the time, don't they? And you'll hear a lot more about that. I don't need to go into that. There's also the what happens when we have certain behaviors related to pain or to our sleep deprivation, how other people react to us. So that's this one here. I've talked about outcomes of our behaviors, the feedback that we get. And then there are all these environmental forces. And this is what I like to call low-hanging fruit, because some of these other things are not that easy to intervene or to change, but the environment is something that a lot of us have quite a bit of control over. The amount of light in a bedroom, the temperature of a bedroom, and the sound in a bedroom, all of those things very significantly influence the sleep that a child gets, and the sleep that a child gets influences the amount of pain that they perceive. So these things are areas I believe that we should start with, looking at this low-hanging fruit, trying to make that as possible so that hopefully we can decrease some of the other problems. So I'm sure a lot of you know more about this than I do, that feeling with the child. So what are the interventions? What can we do? Well, first people need to understand how pain works. And there's some wonderful little YouTube clips out there and some interactive websites for both sleep and for pain. So there's this one called Pain in the Brain. That's a YouTube clip. There's an interactive BBC website, and that is, there's all kinds of games and interesting things that you can do on it. It's quite entertaining, but you learn a lot at the same time. There's also iPhone apps that you can download that help you understand sleep and to record your pain experience or the child's pain experience. There's all these, CBS has a lovely series on this called The Science of Sleep that you can watch online, and it very clearly explains why sleep is such a significant issue across the lifespan. There are pain and sleep resources that we've pulled together on a website, and you just go to www.othealthliteracy.ulberta.ca. And then there's a wonderful pain site that was developed by the Dalhousie University, Pain and Children's Health. And you can get so many excellent resources there, and I would highly recommend that to people. The other things you want to think about having to do with pain and sleep, these two put together, is caffeine, and I'll flag that up for you. Caffeine interferes with sleep, we know that, but it also decreases the effectiveness of pain medication. And a lot of people don't know that. This is new research that's starting to come out. One of the things I really want to point out to you is this new product that's on the market. It's a chocolate bar that's called Awake, and it actually was sponsored by the Dragon's Den, so it got a lot of publicity. Now, what's interesting about it is they have supplemented the amount of caffeine that goes into this chocolate bar. They've added 101 milligrams of caffeine. And you think, well, okay, so what? I mean, and it's over the counter. Anybody can buy it, so any child can go into a grocery store and buy themselves a chocolate bar. Well, the recommended maximum caffeine intake for children is 45 milligrams. So one of those chocolate bars is double what a child should have in the day. Even an older child, it still exceeds what the recommended amount is. And there are many other hidden sources of caffeine in children's diet. So you want to remember that sleep and pain are systems. And the other thing that I like these two pictures because I think they make the point really clearly. In a system, sometimes very small nudges, a number of little nudges, will actually move you further than one great big push. And that makes a lot of sense, right? Instead of looking for the great big solution like pushing that car up the hill, Let's look at the little tiny nudges. And if you want to clear a room, what do? You throw in a couple of mice. They're little things, little nudges, but you get more activity from those mice than you ever would. You'd get more movement from the mice than you'll ever get from a big push on that car. So, what are some of the other things when I talk about this low hanging fruit? What are some of the other things you can do? You can look at light, because light suppresses melatonin, all those computer screens and electronic devices, ambient light. You can even you can download an app. This particular one that's on the slide is free, and you can test what the lux level in your child's bedroom is at night. And you want to be careful when the lux level gets over 30. Okay? That starts to suppress melatonin production and decreases the efficiency of a child's sleep. And you can talk to healthcare professionals and your occupational therapist about ways you can decrease the light in the room to still keep it safe for the child, but to attend to excessive light and to making sure that they're not exposed to excessive light prior to bedtime, especially things like electronic devices and reading bedtime stories from tablets instead of from books. Temperature is important, right? So we want the core temperature to drop a little bit when children are sleeping. Sound is important. Anything more than 30 decibels interferes with deep sleep. And yes, there's an app you can get for measuring decibels. And just this little grid here shows you normal conversations. So two parents talking outside a child's bedroom door actually exceed the level that we know will start to alert a child, right? So these are the kinds of things that once you have this information, you can apply to your own situation and make your own choices about. These are little things, but little things all add up. So where do you start? Well, I think it's important to, be realistic. People are very, very busy. You have incredible demands on your energy and your resources. So don't be looking for the great big fix. Instead, think about little things you can do, little low hanging fruit. And, I love this picture, right? Just like eating an elephant, you do it one bite at a time. So thank you very much for the opportunity to be with you today. And I hope the rest of your conference goes very well. Take care. Bye.